For the final lecture in Unit 3, we are going to examine the concepts of social issues and social problems, social change and social justice, and what they mean in community psychology. Up to this point, you have learned how the field of community psychology has come to be, the social movements that have influenced its development, and how values and principles play a role in community psychologists' approach to research and their interactions in communities. Before examining social justice, we are first going to examine social issues. Think about what a social issue is. For your topic of interest assignment, you are asked to choose a social issue that you will be following throughout the course. Social issues are considered to be problems that affect large groups of people within society. If you think about these issues and examine the groups of people disproportionately affected by them, you will often see the disparities reflected through race, class, and gender. Examples of social issues that you can choose for your topic of interest paper include education inequality, food access, gender-based violence, homelessness, juvenile justice, mental health, substance abuse and addiction, and veterans issues. Murray Levine, a community psychologist, and Adeline Levine, a sociologist, wrote a historical analysis of how public beliefs about social problems or social issues and helping services in the United States have been shaped by both social and political forces over time. Their hypothesis stated that in times that are marked by optimism about the possibility of lessening social problems, these problems or issues are conceptualized in environmental terms. People see problems and solutions existing at the community or societal levels. During these times, investments are often made in social and community interventions in order to address these issues. On the other hand, in less progressive times, when there is an overall pessimism about the lessening of social problems, the same problems are conceptualized in individualistic terms. There is a greater emphasis on individual causes or deficits, and in turn, the focus is on changing individuals themselves and their behaviors. If you think about the funding of research today, much of the research around social issues are focused on mental health, drug abuse, and individual rehabilitation. Let's think back to what you learned in the lecture on historical contributions. During the 60s and even the early 70s, people were much more optimistic about creating social change. They were getting more involved and saw problems needing to be addressed at multiple levels, including the changing of laws and services. Alternatively, as we moved into the 70s and even up until now, there has been much more of a focus on how to change individual behaviors. For example, drug and alcohol addiction, which we will talk about further in the unit on prevention and in this lecture. It's still mainly seen as an individual level problem. People typically have two options for this problem: treatment and jail. While those both focus on individual behaviors and can potentially be helpful for certain individuals, there is less focus on the causes of addictions outside of genetic factors, including the oppressive forces that introduce drugs into communities and keep them there. Levine and Levine's study highlights the two paradigms that influence the two basic perspectives of change. First-order change takes on an individualized perspective. It is focused on the altering of individuals, rearranging of roles, or replacement of individual members of a group. On the other hand, second-order change is a type of structural change. It is focused on the altering of relationships among the members of a group, especially their shared goals, roles, rules, and power relationships. So if we go back to using addiction as an example, first order change efforts are focused on changing people's behaviors through rehabilitation or through jail in order to reduce the number of people living in a community with active addictions. An example of second-order change regarding the same issue would be identifying and changing policies that are both making it easier to access habit-forming drugs in certain communities and making it difficult for people to become rehabilitated. So this could include changing drug laws, finding alternative therapies that may have had more success than the traditional rehabilitation programs. These could include needle exchange programs or the Oxford House, and reforming drug prevention programs that are targeted at youth. The Oxford House is an example of a program using second-order change to address addiction recovery. This is a residential setting for those recovering from substance abuse. The Oxford House includes a spacious dwelling in a lower crime neighborhood. Residents of the house must pay rent, perform chores, and remain drug-free while staying there. Residents are in charge of choosing their own treatment, which can include professional treatment or mutual help groups. And the houses are all governed democratically with leaders chosen by the residents and not the staff. The Oxford House represents second-order change because it is not simply focused on the traditional roles of a patient, where it's someone living with an addiction and the staff. Instead, it makes everyone in the house who is in recovery more accountable for their own behavior and for each other, in the context of equality, support, and shared community. As you've learned, community psychology takes a much more structural perspective to understanding human behavior and conditions. Second-order change efforts include an understanding of how structural and systemic factors contribute to societal problems. So what do we hope to accomplish when engaging these types of second-order change efforts? Community psychologists would say that second-order change can contribute to social justice. By shifting the focus of change from individuals' behaviors and role replacement focusing change on structural forces contributing to an issue, second-order change helps people understand how an issue affects groups in different ways. Social justice helps us to understand that groups of people may experience an issue in different ways, and that in order to address this issue, we must focus our efforts in multiple places in an equitable and sustainable way. One of your tasks for this week was to watch The Deadly Deception. Hopefully, you will have learned something new about how research has historically been used to harm and further marginalize a specific group of people. As you think about this movie and reflect on it, you should go back to what you've learned about values and principles and reflect on what that means for those involved in research and how it has influenced human research today.